test 1 2 1 2. There you go. It was on the whole time on hardwired. No, but like all their auxiliary stuff. Yeah, I don't Yeah. So call you? Alright, sounds good.
afternoon, morning, still morning, right? How y'all doing today? Good to see everybody. Well, I'm joined today by Dr. Carla O'Day, leads the emergency department at St. Vincent Charity Medical Center. Has many years experience in medicine, many years experience in emergency room work, and she has dealt with a number of COVID patients over the last few months. So I'll talk just for a few minutes, then I'll turn it over to the Dr. O'Day, and she'll take questions and I'll take questions. So thank you all very much. Every county in Northeast Ohio is now literally on fire from this virus. This is a chart which you won't be able to see, but it's a chart of each county in our region, Northeast Ohio. Every single county is at a very, very high rate of COVID. The CDC measures it by how many new cases in the last 2 weeks per 100,000. And if you look through here, every single county is at least 3 times the CDC's high incidence level, at least 3 times higher than that. Some of the counties, most of the counties are 4 and 5 times, and we have, very sadly, Lake County that is at 1,000. Which is 10 times the positivity level for high incidence. So in Lake County, for example, in the last 2 weeks, 1 out of every 100 person has been diagnosed with COVID. So it's just a phenomenal raging fire going through the state. Now there's good news. The good news is that we have a vaccine coming. We have vaccines coming. And the news that we heard yesterday, the news we heard last week indicates that these vaccines are about 95% effective, which I'm told by doctors is a really phenomenal high level. So that is great news. We hope, Trump administration tells us that we will start getting these in Ohio in December. The first batch will be, we're told, 30,000, and we will have batches come from then going forward. So we will first try to put a shell around or a wall around to protect our nursing home patients, and we'll do that by giving the vaccine to those workers who work in nursing homes. At the same time, we're going to be reaching out to our healthcare workers to get them vaccinated as well. This will take a while. This will take a number of months to get done. But for the first time, we now have great confidence that this vaccine is here. It's going to be used, and it's going to take us out of this great tragedy. But we have a few months to go. And so we all together have to build a bridge. We're in the process now of building a bridge to get us to that time in the future. And what we do in the next several weeks as Ohioans will determine if we can really build this bridge and if we can slow this spread of this virus down. So we have taken some actions in the last week that should help, but the most important thing is what each individual Ohioan does. Last week, we expanded our mask order to make sure that in retail establishments, if you walk in and you're shopping, you go to the grocery store, wherever you go to, you should have assurance that everyone in that place is wearing a mask. Conversely, if you're at the checkout, if you're stocking shelves, if you're doing work that is frontline work that you need to be doing, and you're medically compromised, you have every right to expect that everybody who walks into that store has one of these. So we now have inspectors who are going out. They started yesterday morning. We're already seeing mask compliance go up in our rural areas where it's been low. So we're confident that this is going to help a great deal in our retail establishments. Second, Yesterday, I announced a curfew. The curfew will start tomorrow night at 10 o'clock. It will run from 10 o'clock until 5 a.m. And the whole purpose is to reduce the number of contacts that people have. You remember in the spring, we were able to dramatically cut down contacts, and people stayed home more. They made decisions, well, instead of going to the grocery store a couple times this week and running out to get milk or do that, I'm going to pull back, I'm going to make a list, I'm going to do it once. And it's just things like that. So we're asking people to slow down. We're in a slowdown, certainly for the next 21 days. If we slow down, if each one of us, every single day, cuts down on the number of contacts that we have with other people, and if we wear a mask, we can knock this down very, very well. Let me now introduce Dr. Carla O'Day. And Doctor, thank you very, very much for joining us. I'm going to get out of your way and we'll let you step up. And
Thank you, Governor. Thank you, Governor, and thank you for your commitment to public health. It's been very important to all of us. We've seen an incredible increase in the number of COVID tests and cases in the state of Ohio. In September, we were seeing about 1,000 a day statewide. We're now seeing close to 8,000 statewide. And not real clear what happened. Some of us in emergency medicine think it's from Halloween. The timing is right. It takes about 2 weeks for this virus, once you've been exposed, to really take over in your body. So we think about 2 weeks, and that would be Halloween, and there were lots of Halloween parties. The holiday that's coming up next is Thanksgiving, and I would urge all of you to rethink your Thanksgiving plans. Make them small or skip it this year, because you know next year it's going to be much, much better, because we will have had the vaccine and we will have a certain level of immunity in the community. But this year is different. It's now up to us. As the governor said, the vaccine is coming, and it sounds as if it's going to be very effective. It's 95% effective. They're starting to get it available to be distributed probably in December. But in the meantime, we have to do our very best. All of you that are watching, please do your best. That means wearing a mask, always wearing a mask, washing your hands as much as you can, using hand sanitizer whenever you can. Limit your gatherings. Keep them very, very small with social distancing, or have them just not at all. This is not the year to have that big Thanksgiving dinner, which I do, by the way, every year. I cook for 30 people, and I'm there, and everybody looks forward to it. I mean, we really like it. We play games and watch movies, and it's wonderful. I'm going to miss it this year, but we're not going to do it. It's just too dangerous. Not only because of where I work, but because, you know, we're all out in the community, and we can carry it around. You can have this virus. It's a deadly little virus and never even know you have it. The other thing about this virus is that, yeah, you can get over it, but it has some long-term consequences of it in terms of cardiovascular disease, in terms of neurologic disease. We've seen many, many patients who come in, they get over the disease and then come back or have a heart attack or a stroke while they're still in the hospital, even though they've markedly improved in other areas. This has some effects on the vascular and neurologic system that we're not truly aware of yet, but it's there, and it can happen in really young, healthy people. So this is not something you want to get. This is not innocuous. We have to do everything we can to keep away from it. Next Thanksgiving, I think it'll be really nice, but not so much this time. We will, as the governor said, have this vaccine coming, and it's going to take a while to get us all vaccinated. In the meantime, everybody needs to do their very best. We're a country and a state that have had to sacrifice many things over the years. You know, the world wars took sacrifice. You know, there were rations and all kinds of things. So wearing a mask and washing your hands and limiting your contact in the big picture is not so awful, especially when we know that help is coming and help is along the way. The other thing I wanted to mention is what we've seen at St. Vincent's, and we have a very large behavioral health unit, is that we're seeing more and more behavioral health emergencies. This is hard on people, staying home, schooling your kids. You know, it really is very difficult not being able to get out, not being able to go to family gatherings. And so, you know, we're seeing more and more. It's just something you should be aware of. And we should pass on to our fellow citizens, you know, look for signs of mental illness, of depression, and get help. Our emergency department visits have gone way, way, way up in terms of behavioral emergencies. So be aware of that and pass it on. I hope you all have a very happy Thanksgiving. I will be sitting on my front porch waiting for kids to stop by and say hello. It'll be very brief, and we're not all going to get together at the same time. But I hope you all have a very Thanksgiving, and I can promise you that Thanksgiving in 2021 is going to be much, much better. Thank you.
Questions for the doctor?
Doctor, is there a concern that people might try to go get a COVID test, it comes back negative, and they use that as a false sense of security to go visit their family, not wear a mask, not quarantine, and have what is otherwise a normal Thanksgiving?
Yeah, that is a great question, and that's true. I mean, the tests have a very high false negative rate. So just having a negative test doesn't mean that you're necessarily negative in the big scheme of things. You can be negative and the next day be positive. The governor had that. He was positive and then negative. So the tests are not the most reliable things in the world. There is a home test that's supposed to be pretty reliable that will be available soon, that you can just use in your home. It's a swab, a nasal swab, and you'll have the results in about 30 minutes. That might make a huge difference, but just having a negative test does not give you carte blanche to go out and go to Thanksgiving. Okay.
It must be very frustrating to have to keep saying the same things over and over to people. I know the governor's done the same thing. Why is it not sinking in? What more did you say? What drastic terms did you put this in to make people get it? That 2 weeks from now could be that much worse, and 2 weeks from then could be that much exponentially worse.
Yeah, I don't know. I wish I knew. If I knew the answer to that question, because the governor, all emergency physicians that are out in the community, we are preaching that this is a deadly virus. Nobody is immune from it, nobody. And that it can have long-term consequences, so just mask up, wash your hands, and you'll still see people out in the community, hopefully less now, with no mask. Stores and retail centers are getting better about having people on the door and handing out masks for them. But it's just this denial that this can't really happen to me until they see somebody where they really get it, or where their family member has gotten it and become gravely ill. Until then, nobody really thinks it can happen to them. Trust me, it can.
Speak to the exhaustion that you and your colleagues and the health community are dealing with right now at Curfew Hospital. ER visits from a number of different reasons are going up. Are you tired?
Yes, we all are. We all are, because it's difficult, because when you work in that emergency department, number one, it's much more intense than it was. Some of our numbers are down because people are afraid to come in. Whole other area. So we're seeing people with chest pain who've had it for a while and are having a heart attack, but didn't come because they didn't want to get COVID. But we're all out there working really hard, having to be really careful about personal equipment, protection gear, and then we're going home. And that really is fraught with a lot of distress. When you're going home, you're undressing, a little area of the porch and throwing your clothes in a bag and hopping in the shower, because you don't want to carry anything home to your kids or your family. So that's a whole another area of stress that can happen.
If we see the same kind of spike 2 weeks after Thanksgiving that we saw 2 weeks after Halloween,
I'm worried about that.
what would that do to your workforce, your bed capacity, supply?
It could be really difficult. We're already low on beds in the community, and we have a new hotline that we've set up so that the main hospitals in this area, Metro, St. Vincent's University, and the Cleveland Clinic, have a common transfer line, so when our beds start to get full, which we're starting to get, that we can share the beds with other facilities. So that's going to help. Otherwise, you know, we've got, in some states, we have not done that yet, we have caregivers working even though they're positive if they do not have overt symptoms. I hope we never get to that, but you know, we're down on caretakers who have actually the virus and are continuing to do what they can to get back to work.
Doctor, let me add one thing.
Yes, please.
You know, this is so much different than what we saw in the spring. Very, very different. And one thing that's different is in the spring, first of all, we didn't have every state on fire at the same time. Now we got every state in the north is on fire. Second, every county of 88 is on fire. In the spring and the summer, that wasn't true. Particularly in the rural areas, you could go and people didn't know anybody that had it. So when we talk about stress on the hospitals, the real stress is going to be, and is already, on the personnel. We have no place to borrow nurses. We have no place to borrow doctors. You know, we had nurses go to New York City from Cleveland a few months ago. It's going to be hard for us to get nurses from anywhere, doctors from anywhere. So that's, if you talk to hospitals around the state of Ohio, what they tell me is that is their biggest concern. It's people. The numbers are just phenomenal. 1 month ago, we had 1,000 people in the hospital. A week ago, we had a little bit over 2,000. Today, I don't have the numbers for today yet, but yesterday we were at 3,600. So it's just going up like that. And we know with cases ranging now between 7,000 and 8,000 a day, hospitals are lagging indicators. So even if we turn this thing around, this ship around right today, we know that this hospital admissions, at least for a while, are going to continue to go up. And that's what's scary. This is not sustainable. We have to turn this thing around, and we have the ability to do it. And so I'm asking every Ohioan, you know, cut back on the things you're doing. Stay home more. The curfew will take some people out, and that's good, from 10 o'clock. Every retail establishment in this state is going to be closed at 10 o'clock, starting tomorrow night. The gatherings of people. We hear about people who, since bars would close at 10 o'clock, they would go out and, you know, get together. That is going to, we hope, end, and that people will just go home. So I'm asking everybody to go home at 10 o'clock, but I'm also asking those who go to bed at 9 o'clock or 10 o'clock, and so that really is not going to impact them, do something every day. Do 1, 2, 3 things that pull you back a little bit so that you have fewer contacts with other people. If you do that and wear a mask anytime you're out in public, if we all do those things, just those 2 things, we will knock this virus down. And we really literally have got to get from here to here. We're in this area where we don't have the vaccine yet. We're in this area where we don't have the ability to knock the virus down by having immunity throughout the community. We got to get to the next stage. Got to build that bridge. We do it with the mask. We do it by everyone making a sacrifice to pull back some.
Governor, taking into consideration what the doctor said, are we possibly looking at something that happened back in March, which would be a ban on non-elective surgeries or the overnight stays?
Yeah.
And if you did that, would it be statewide? Would it be region-wide?
No. You know, we put a ban on in the spring because the Hospital Association, hospitals asked us to do that. What will happen now has already started to happen, and that is that individual hospitals are making those decisions. Individual hospitals are starting to pull back. We've had several hospitals who we hope temporarily are pulling back from elective surgery when that elective surgery requires an overnight stay. So some hospitals are already starting to do that. As this virus goes up and hospital admissions go up, you're going to see more and more hospitals pulling back. That is not a good thing. I mean, we found out in the spring that when you go for some period of time and people, let's say someone who needs a hip replacement, and they're in a lot of pain and they don't get that hip replacement, it's not good. that's not
That'll
good.
be on
So
a
that-
hospital by hospital basis.
hospital by hospital. I mean, really, what's at stake? We have to turn this around. If we don't turn it around, we're going to have to see more and more schools that are going to close, that are going to go completely remote. We're going to see more deaths in our nursing homes because the more spread there is in the community, the more spread there's going to be into those nursing homes. And we're going to see our hospitals pull back. So, you know, to protect, keep our hospitals open, to keep our schools open, to keep our nursing homes safe, we've got to step up our game. We've got to do it right away.
Governor, I wanted to ask you about the curfew. Is your expectation that the curfew is going to work as well as the opportunity that you had presented that you may close bars, restaurants?
Yeah, we think, look, I think it'll work better. That's why we did it. You know, bars, restaurants would be one sector, but this has been reported, I've seen sometimes as a business curfew. This is not a business curfew, this is a curfew. And so we want people home at 10 o'clock. And, you know, if we don't expect the police to pull somebody over who's driving at night, that's not going to happen. But if police come, you know, up to a group of people who are congregating somewhere, I expect the police are going to be telling them, hey guys, go home, go back to your home. So this is a real curfew, and we believe that by putting this into place, plus making sure that there's real compliance in our retail settings with the mask, plus what we're asking everyone to do is to pull back 20%, 25%. If we do all those things, we're going to knock this virus down. But we got to do them, and we got to do them now because we're running out of time.
It would appear, though, that closing bars, restaurants, gyms, and I'm not advocating for that, obviously, but would affect a lot more people than a curfew from 10 p.m. to 5 a.m. What are you hearing from your people that this curfew is going to work as well or better?
Well, I don't know anybody else has tried this, so I'm not sure. We don't have empirical data. What we do know is basic science. I didn't do very well in school in science. My wife Fran did, so she got the A's. I didn't get the A's. But I've learned some things from the doctors and from the scientists, and that is this virus only transmits when we let it. It goes from one person to another. If we can block it from going from one person to another, we've achieved what we need to achieve. There are many ways of doing it. These masks are very powerful. But if you cut down, if everybody in the state cut down by 20% their personal interactions with other people every day, we would see a dramatic change. We saw this in the spring. If you look at the ODOT miles driven, or you look at cell phone, and cell phones measuring the interaction of people, how far someone traveled a day, you saw those go down dramatically. When those went down, the cases went down. It's kind of basic. So the curfew is one tool. The mask in retail is another tool. So these are two enforcement things that we're doing. And the third thing is not enforcement. It is asking everyone, take it that next step, cut your contacts down by 20% a day, pull back some. All those things combined, we think will work. We're going to find out. We're going to find out.
Governor, last week you said Wednesday or Thursday we'd hear a big announcement. Was yesterday's curfew announcement what you were talking about? And
Yeah.
it came early, or should we expect more to come
No,
today or tomorrow?
no. Look, we're going to do what we have to do, but we've taken some very strong steps that have not been taken before. A curfew, it's a real curfew. I think is a pretty dramatic step. It's not something we would normally do in a free society, that we would issue a curfew, but you know, this is not ordinary times. We've not seen anything like this for 100 years. And so we've got to get control of it. I spent the weekend, frankly, talking to a lot of different people, trying to figure out what we could do that would be effective. And last week we did talk about bars and we did talk about restaurants. But there's downsides to any time you shut things down. You know, the doctor was talking about mental health. People lose their job, that's a mental health problem anytime. People can't feed their kids. A single mother who works in a restaurant. So all these things are things that we have to balance. And I think what we need to do is decide what's important in our lives. And it seems to me keeping kids in school is important. Making sure that single mom can feed her kids and she can work, I think that's pretty important. The inconvenience of wearing a mask isn't a lot. And pulling back 20% on our contacts for a period of time is not a lot. Is it a sacrifice? Yes, it's a sacrifice. Does it change what we're doing? Yes, it does. But let's focus on what we care about. Don't we really want kids in school? Don't we want our grandparents who are in nursing homes to have a decent chance of not getting the COVID? I think we do. Don't we want our hospitals open so that whatever we need, whether it's a heart attack or cancer treatment or whatever, that we are not in any way inhibited from getting to that hospital? It seems to me those are the essential things that we need to focus on.
Gotcha. And
Anybody else for the doctor or for me?
for you, and when you say focus on the things that are important, there are some people on social media that believe this may not be enough. So is there an expectation that tomorrow more will happen in terms of, for instance, we still have Browns games where thousands of fans are allowed to attend. Casinos are still open during that curfew period. High school football will still have playoffs this weekend. Is there any plan to make any changes to those things in the coming days?
We're not ruling anything out. We're going to see how this works. I trust Ohioans. Ohioans have done a phenomenal job. Knocked it down the spring, knocked it down the summer. There's no reason we can't all come together and knock this thing down in the fall. Browns game is an interesting story. I don't worry about people who are outside wearing masks, socially distanced, in a place that we've got 1/5 of capacity, basically. What I worry about is the people who are watching the Browns game who are sitting in their basement with 4 or 5 buddies and not wearing a mask. That's what I worry about.
So Governor, we've talked consistently about how gatherings is a big problem with a lot of funerals, weddings, Halloween, Thanksgiving. So do you feel like this curfew is going to do anything to address that, or is there something else that needs to be done?
Well, we issued an order last week, this weekend actually, in regard to weddings and in regard to funerals and any kind of banquet settings. And we're not interfering with people's weddings. Don't want to do that. Last thing I'd want to do, or the funerals. But it's what happens after that ceremony. And we've now imposed rules that say you have to follow what restaurants have to follow. You have to be seated. You have to wear a mask when you're not actively eating or actively drinking. So we've upped that as well. So we've got new orders on there. We've got new orders on in regard to the curfew. We've got new orders on in regard to retail. So those are 3 things that we have done. Most important, though, is the 4th thing, and that is people stepping up and saying, hey, I'm going to pull back, stepping up, but really pull back. So we're looking for a slowdown at least for the next 3 weeks, and asking everybody every day to look at what you can do to slow this thing down, slow this virus down.
Governor, how did you come up with the hours for the curfew? Obviously, we know coronavirus doesn't just happen at night. So how did you specify?
No, look, and I get that question. It's a really good question. We did not want to interfere with people's ability to make a living. So you'll note that the curfew exists, but if you work at night, you can go to work. Any business is open that's not retail, that is a manufacturer or whatever, they can stay open. We picked 10 o'clock because we thought that would not hurt business a lot, although you'll hear from people who own restaurants and bars that certainly is a big change. But we felt 10 o'clock would not be devastating to restaurants and bars and other places. But by saying everybody needs to be home at 10 o'clock, and by saying every retail establishment needs to close at 10 o'clock, that's a change. It's something we've not done in Ohio before. I don't know if it's been done across this country at all. It's been done in Europe, some. They have done that, and actually they've come up with a lower time. But in Europe, what they have the ability to do, we don't have the money. They have the ability to subsidize people who lose their jobs because of a curfew at 5 o'clock or 6 o'clock or 7 o'clock. So everything we've done is trying to balance. And what I'm faced with and what Ohio is faced with is usually two choices, and neither one is very good. And you just got to figure out where do you do the least harm, where you do the most good, and you kind of try to balance them. So that's where we came up with 10 o'clock. Nothing magical necessarily about it.
Is the closure?
But it's a way to chip away at this. And the interesting thing, if you look at this thing, if you look at people who study this and do models, they'll tell you if you change behavior by 20%, that's a big change. And so that's why I came up with 20%. Pull back 20%. You add to that what people will be pulling back in regard to the curfew. We're on our way to make a big difference.
Is the closure of bars, restaurants, and gyms still on the table?
Look, we're not looking to do any closures, but we're going to have to get control of this. And so this is crunch time. This is a time when we got to step up. This is a time when we got to do it, because we can't let this continue to burn. I know there are some people who say, well, just let it. I got an email yesterday from someone and said, well, don't you understand, viruses just have to play out. They just have to go. Well, you can take that attitude, but you're going to kill a lot of people by doing it. And I think Ohioans are tougher than that. I think Ohioans are not going to run away from this. I think Ohioans are not going to say there's nothing we can do. That's not who Ohio is. We're fighters, we're tough, we're strong, and we've done this twice. We've come this far. The end is in sight. Let's keep going.
Governor, we're hearing some stories from employees who are not necessarily testing positive or having symptoms, but may have had some contact with other employees that have. They're getting pressured, some are getting pressured to come in because, we are seeing these outages, these work outages, where people are actually testing positive and sick. Are you hearing any reports with this, the state, with this surge and
Look.
what would you say to these employees? What are their avenues?
First of all, if anyone feels they're being forced to work when they're sick, they need to call their local health department. Number one. Number two, they obviously should exhaust whatever sick leave that they have or whatever benefit that they have. There is also a third alternative, and that is they will qualify for unemployment for those days that they have to be home. So that's something I think people don't realize, that they can apply for that. Obviously, the best thing is for the company to take care of them and somehow provide. And I would just say that from the point of view of a company, they're better off paying people when they're not there, rather than let them come in and introduce that virus into the workplace. So the virus is coming into the workplaces. It's not spreading much, we don't think, in workplaces, because people are wearing masks and people are being careful.
With this community spread, you're not seeing an uptick in these kind of reports. It's just another you're talking about contact.
Well,
it's another contact.
well, first of all, the question would be better asked to the health department. They're the ones who are getting the calls. So I'm on the phone every Monday morning for a call with all the health departments, but to find out what really is going on there, you should talk to the health department. I mean, look, the more spread you have, the more everything is threatened. And again, I said in Lake County, 1 out of every 100 people in the last 2 weeks has been diagnosed with COVID. That's a phenomenal number. It's
Do you feel
shocking.
confident in this? There's so much of a spike, so much of a surge. Do you feel confident in the contact tracing that you can say that these are still these social gatherings, these friends and family, rather than workplaces, indoor dining? Because I know it's very stressed.
Yeah, look, they're spread everywhere. All I know is what the 113 health departments tell me, and they're the ones who are doing it. And we have to keep in mind that you make a very good point, that once you have significant community spread, it is much more difficult to pinpoint one place where that person got it. A person will come in and they'll be interviewed on the phone, and they'll say, I was at work, I went to a bar, I went here, I went there, and nobody knows where they got it. And so, that is very common. But when you look at where the big spread has been, when you look at where we've seen the outbreaks, you know, a lot of them in funerals, a lot of them weddings, most of them, the health departments will still tell me, come from people in their interpersonal relationships where they just let their guard down, didn't wear a mask, they were family, they were friends. But it's spread everywhere.
Governor, how will enforcement of the curfew work? Will that fall on local police? Because I know some said they didn't want to enforce the mask mandate. It wasn't their responsibility.
Yeah, look, we're not asking police to go pull anybody over. If you're in your car, you know, no one should be bothered being in their car. But the other example would be, you know, if you've got at a gas station at 10:30 at night and there's 4 or 5 people hanging around, I would think the police would stop and say, hey, go home. Get out of here. Go home. You know, we're not, we know the police have a lot to do. I believe that most Ohioans are going to follow this, and we'll go home, be home. We know there's going to be emergencies. People have babies, things happen. So, you know, those people should be able to do what they need to do. So, yeah.
There have been a couple examples up here of establishments that have just blatantly been violating the state club orders. Does the punishment on the state level fit
Yeah.
the crime down here?
Well, are we talking about bars?
Yes.
Yeah. I have to be careful what I say because the Liquor Control Commission is a semi-judicial body, and I don't want to overstep my bounds in regard to that. But I think that you will see that repeat violators will lose their license. That's up to the liquor control, but you know, people should not think that they can continue to put their fellow Ohioans in harm's way and jeopardy and not be some consequences. And for the bars, it is a license granted by the state. So this is up to the liquor control, but I think you can expect to see some tough action from the liquor control.
Governor, you know, you mentioned that you're confident we're going to be able to tamp this down again because we did it during the summer. But, you know, in the spring we shut things down, we shut a lot of businesses down. In the summer we had a much greater ability to go outside and gather there. So are you concerned that without those two things, without those
Sure.
two factors,
Sure, I'm concerned about that. Sure. Look, I didn't say this is going to be easy. And, you know, we're balancing a lot of different things. We don't know where this is going. But, you know, I'll just end. Michelle's telling me I got to go. I'm off to Youngstown. But I just want to end on this kind of happy thought, at least for me. In the last 9 days, Fran and I have had 2 grandchildren born, a granddaughter and a grandson. And what motivates me to wear a mask, what motivates me to keep distance, what motivates me to not get too close to them now. We wanted to see we've seen our grandson, granddaughter, saw one last night, one tonight we hope. But what motivates us to continue to be careful and continue to make sacrifices is, you know, we all want to be there next Thanksgiving. I intend to see those grandkids grow for a while. And, you know, Fran and I have 26 grandchildren, and they're a great blessing in our lives, and we have a lot to live for. And I think most Ohioans feel that they have a lot to live for. All Ohioans have a lot to live for. So let's make some small sacrifices now so that we can have many, many years of whatever we love to do, whether it's going to see the Browns, the Indians, whatever everybody likes to do. We got a great life ahead of us. Let's just don't mess it up. Let's be careful. Thank you all very much.
Thank you, Governor.
Doctor, thank you.